Hi, my name is Nicole, and I'm the Education Coordinator for Family Medicine Residency in Terre Haute, Indiana. And I'd like to speak up to protect graduate medical education funding. And hopefully, my video will reach U.S. Senator Joe Donnelly, a Democrat from Indiana. I'd like to protect graduate medical education funding for primary care physician training, protect it from budget cuts, and basically by continuing the financial support to training programs for primary care providers, increasing healthcare costs will be restrained and we'll have new physicians to counteract the impending physician shortage crisis. The shortage is currently listed at 16,000 doctors, but the Association of American Medical Colleges projects the shortage will climb to 62,000 by 2015. So, further complicating the healthcare system, 25 million new Americans are projected to enter the U.S. healthcare system under the new Health Exchanges and Affordable Care Act. So, new medical schools are opening throughout the country, and current medical schools are increasing enrollment to train more doctors, which is great. This is a positive change. However, residency program funding is creating an obstacle here because medical school graduates, they may be increasing, but residency training spots are not increasing. So, we're creating all of these new positions to train doctors, but then after their medical school, then they have nowhere to go. So it's not going to really alleviate any of the physician shortage crisis. And this is all due to the lack of GME funding. So should Congress decide to cut GME, reduction should be prioritized and targeted, not across the board. So training programs leading to an initial certification should be the ones that are protected. And cutting only programs that lead to secondary certification would fund the basic training of all physicians. So basically, physicians that are attending a first residency, that funding is what I would like to remain intact. And then if budget cuts are necessary, then cutting the funding for the secondary education would probably be a better idea. In July of 2011, the Accreditation Council for Graduate Medical Education stated in a letter to its member organizations that one of the major problems with abrupt and severe cuts to GME is its impact on primary care physician training. So, sponsorship of residency and fellowship programs accredited by the ACGME is concentrated in 681 healthcare-related institutions across the United States. And over 300 of these institutions sponsor only one residency program, which are predominantly primary care programs in small rural locations. So without continued GME funding and support of primary care training programs, many of these institutions will be forced to close their doors. So this reduction in training programs will add to the devastating primary care physician shortage. So if GME funding is cut, as a nation, we will be unable to reduce health disparities and respond to social determinants of health. Should Congress need more cuts from GME, it should protect primary care. And primary care helps keep healthcare costs lower for patients. And according to the Council on Graduate Medical Education, COGME, in its 20th report published in December of 2010, there is compelling evidence that healthcare outcomes and costs in the United States are strongly linked to the availability of primary care physicians. So for each incremental primary care physician, there are 1.44 fewer deaths per 10,000 persons. Patients with a regular primary care physician have lower overall healthcare costs than those without. So you see that physicians, especially primary care, really have a place in the United States. According to the American Medical Association, there are top 10 reasons that graduate medical education funding should be protected. And the number one is to, like I said earlier, alleviate physician shortages. Because, by 2015, all specialties, not just primary care, will have a shortage of 130,000 by 2025 and 62,000 just by 2015 alone. Preserving patient access to care is another really important piece. With the passage of the Health System Reform Law, the Patient Protection and Affordable Care Act, the demand for physicians will significantly increase as 30 million Americans request more healthcare services starting in just 2014. And then ensuring the availability of vital patient services in underserved communities. Our family physicians are the ones that are out there in our small towns treating individuals, and Many of those medical residents train at teaching hospitals where they care for the underserved, indigent, and elderly, including 28% of all Medicaid hospitalizations. So, protecting charity care is another aspect. Teaching hospitals where medical residents train, they provide approximately 40% of all charity care at a cost of $8.4 billion annually. Also, care for our veterans. More than 37,000 medical residents receive some or all of their part of their training at VA hospitals while caring for active soldiers and veterans. Contributing to a healthier community at large. That's another aspect. Medical residents provide complex and acute care, and those teaching institutions where residents train often operate at a loss to provide specialized services and support clinical research, and they rely heavily on federal GME funding just to stay afloat. Meeting the needs of our growing and aging population, this is a real problem. Our workforce experts predict that a growing and aging population, advances in medicine that lead to longer life, and an aging physician workforce will significantly increase demand for physician services just in the United States. Ensuring training opportunities exist for medical school graduates, that's another aspect. While we have new U.S. allopathic and osteopathic medical schools opening, and many medical schools expanding their enrollments, GME training programs are experiencing minimal growth due to limited general funding, and as a result, the U.S. medical school graduates may exceed the number of available residency slots as soon as 2015. So we're already starting to see an impact. Ensuring training opportunities exist for international medical graduates. International graduates comprise almost 27% of medical residents and fellows in the United States and 25% of all practicing physicians. They provide much needed patient care since many of them enter primary care specialties and serve in underserved and shortage areas, including intercity and rural areas. So this is really important. And last but not least, the American Medical Association says that encouraging our nation's best and brightest students to pursue a medical career, that's our best bet right now. Becoming a physician requires a huge personal and financial commitment, and most physicians have undergone 11 to 20 years of education, including their undergraduate training, medical school, and residency training. So without adequate funding for these training positions, students, especially those from diverse ethnic and socioeconomic backgrounds, they may be discouraged from pursuing a medical career, which would have a major impact on patient access to care. So this is why it's really important to save our graduate medical education funding. And if budget cuts are inevitable, make sure that we are selective about where we make those cuts and that they're not across the board, because without funding some of these training programs, we're just hurting the entire nation. We're not going to have enough physicians out there with skilled training to care for our aging populations, our veterans, and current active military. And so this is a real issue. This is something that needs to be at the forefront of everyone's thought, and especially our U.S. senators. So I would appreciate your help in protecting our graduate medical education. Thank you.